Pearls never go out of style, do they? I don't know, but I do like them. Hi, beautiful people. How are ya? I'm Dr. Pammy Jean. I hope you're having a great day. So, I've been trying to stay busy around here. I had my grandson spray wash our front deck so that we can get it stained. Well, we're going to stain it. Probably me, mostly, with some help from my granddaughter, maybe, and definitely my husband. The plan is to do it this Friday. Today is Tuesday, and I hope the weather holds out so that we can get it done. I know it's going to take a lot longer than I think because the deck is pretty big, very long, but you know, one moment at a time. Yesterday, I helped my granddaughter clean out her closet and get it organized, and she loves it. Thank goodness, because it was a disaster. I've slowly worked on my utility room. I think I shared that with you all. I painted it, just one wall, again, one little step at a time. And then I reorganized it so I could find things. And now I got a big mess on a table of things that I don't know where they go. I think they'll go in the garage because once the deck is done, the next step is to go out there into the garage and, you know, organize that because it's a disaster too. So it's definitely time to get that straightened out there. And I bought 4 large plastic container bins to put some of the keepsake things or whatever he wants to put in them for out in the garage because there is an area to stack them. But one of the biggest things is the tools, being able to find tools. So, because one thing we have to do with the deck is we have 3 gates. It's because we have always had dogs and it's to, contain them in areas and hopefully prevent them from getting out when they shouldn't. But over the years, they've sunk and scratched the deck floor. So they need to come off, get planed, and then get put back on. And my husband's going to try and get them off today so that we can work on that. Future Pam here, and he did get them off. When you're working full time and working a lot of hours, life is just hard sometimes. So that's where I come in now that I'm retired, is getting some of these things done while my vision is still fairly good. And, he's really busy right now with the garden and canning and the like, freezing things. And so I just need to catch him at a time where he isn't that busy to get a few things done for me, that I am not capable of doing. I don't know how or don't have the strength to do it. So I need his help. And honestly, I've been glad for the break because, oh my gosh, I hurt my back. Cleaning Katie's closet out was a lot of work. Took me all day. And then she got home and helped me do the finishing touches. My Lumi Health heating pad has helped me heal, thank goodness. On with what we came here for. If you think your skin sensations are a bit much regarding fibromyalgia, we're told that, paresthesias are common in fibromyalgia. Most of us have them, but maybe what we're experiencing is a bit much. The burning, tingling, numbness is just awful, along with maybe some burning pain. And so if you think, you want to pursue a diagnosis of small fiber neuropathy, then I'm here to explain to you the different tests that are performed to help with that. It could be fibro, just fibro. well, not just fibro, that's a lot in and of itself, but it could also include small fiber neuropathy because about half of us have that, and most of us are undiagnosed. There are two tests in particular for small fiber neuropathy. One is quantitative sensory test, QST, and the other is skin punch biopsy. And today I'm going to try my best to explain them to you and what they mean and what they are and how the results can affect us. So here we go. So let's start with quantitative sensory test, or QST. This is a method doctors use to check how your nerves respond to things like touch, temperature, or pain. They use tools to measure sensations like a gentle vibration or warm probe to see how your nerves are working. It's often used for conditions like neuropathy or chronic pain. Quantitative sensory testing is used to evaluate small fiber neuropathy or any peripheral neuropathy condition, but QST is used to determine if there is sensory nerve damage in the hands and feet. It assesses the function of small nerve fibers, which handle sensations like pain, temperature, and light touch. By measuring responses from the patient's to controlled stimuli, such as heat, cold, or vibration, QST can detect abnormalities in sensory thresholds, helping diagnose small fiber neuropathy, where other tests like standard nerve conduction test or conduction studies may not pick up issues with small nerve fibers. And we know that it can't. I've had several nerve conduction tests, and I tell them, I don't think I have large fiber neuropathy. But, they want to do that. I don't get it. So I am going to pursue the small fiber tests on my own because the one doesn't help and doesn't pick up on those changes in the small nerve fibers. QST is considered a psychophysical test. It relies on a patient's ability to accurately perceive and report his or her sensations, making it a psychophysical test. It's often used alongside other methods like skin punch biopsy for a complete picture, and we're going to talk about that in a moment. Quantitative sensory testing for small fiber neuropathy is pretty straightforward and precise. A trained technician uses specialized tools to apply controlled stimuli to your skin, usually on your hands and feet. They might use a device to deliver heat or cold to test temperature sensitivity, or a vibrating tool to check vibration sense, or a pinprick to assess pain threshold. You'll be asked to report what you feel, like when you first notice the sensation or if it becomes uncomfortable. The equipment measures your responses, like detecting thresholds or pain tolerance, and compares them to normal ranges. It's non-invasive and takes about 30 to 60 minutes is all, and it's done in a quiet, controlled setting to keep results accurate. Results from quantitative sensory testing for small fiber neuropathy shows up as data on how your nerves respond to stimuli like heat, cold, vibration, or pain. They're usually presented as numerical thresholds, basically. the point at which you first detect a sensation or find it painful. For example, you might get a number for the temperature in degrees or Celsius, where you feel heat or cold, or the vibration intensity in micrometers you notice. These are compared to normal ranges for your age and sex. If your thresholds are higher or lower than normal, and you're needing hotter temperatures to feel warmth or not sensing vibration well, it could indicate small fiber neuropathy. Results might be graphed or listed in a report showing which nerves, like A delta or C fibers, that aren't functioning right. Abnormalities often point to reduced sensitivity, called hyposensitivity, or increased sensitivity, like in hypersensitivity. I had a skin prick many years ago when fibro was developing in my body. I had severe pain in my hips, and my feet hurt like crazy, and my legs were so stiff. My ankles would pop and freeze up. And so my doctor sent me to a neurologist. At that time, everything was normal. And he recommended a rheumatologist, who eventually, the second neurologist, diagnosed me with fibromyalgia and hip bursitis. So now let's talk about the punch skin biopsy. The punch skin biopsy is the most reliable test, checking epidermal nerve fiber density with a quick 3 millimeter sample from your leg. First, the skin is cleansed with an antiseptic and the area is numbed with a local anesthetic. And then the doctor uses a circular tool to remove a small cylindrical sample of skin, typically about the size of a pencil eraser, 3 millimeters. And they use that for examination. Skin biopsies are often performed to diagnose skin conditions, assess suspicious moles or growths, and determine if a skin lesion is cancerous. I was facing getting that done for my lichen sclerosis, but they decided I didn't need it done. It was definitely what it was. But it also is used to diagnose small fiber neuropathy. It provides objective, quantifiable evidence of nerve fiber damage, particularly in cases where other tests are inconclusive. In addition to sensory fibers, the biopsy can assess autonomic fibers like vasomotor to provide a more comprehensive picture of small fiber neuropathy. By confirming small fiber neuropathy, the biopsy can prompt further investigation into potential underlying causes such as diabetes, autoimmune disorders, or genetic conditions. The immune mediators associated with small fiber neuropathy are Sjogren's syndrome. We've talked about that. Sarcoidosis and celiac disease. I mean, who knew? It would be important to know if these are issues for us with fibromyalgia, would it not? Patients often have pain, numbness, tingling, and burning in the feet, or just one of the symptoms. So pain is the most prominent symptom and often burns. These symptoms may be worse at night. And sometimes contact with warm or cold water elicits discomfort or pain, called thermal allodynia. In my case, cold water is painful. I mean, icy cold water, not just cool water. Yet in others, nocturnal pain, restless leg syndrome, cramps, get those, and fatigue are common. The degeneration of somatic small nerves, namely unmyelinated C fibers and thinly myelinated A delta fibers, can both carry thermal temperature and pain sensations from the skin to the spinal cord and then eventually to the brain. But since these symptoms can appear in fibromyalgia as well, they're often overlooked and dismissed. That's how I feel. I mean, maybe it is what it is, but I'd like to have the test to rule it out. Just rule it out. So it's nice to know there is a test to accurately detect correctly if there is another issue, because patients can have concomitant autonomic neuropathy. The autonomic nervous system testing can provide objective confirmation, such as heart rate and blood pressure measurements. I mean, this is something else to talk to your doctor about, that I've included this because, I mean, this is kind of a whole other story. Autonomic neuropathy affects the internal organs, such as the bladder muscles, cardiovascular system, the digestive tract, and the genital organs of the autonomic nerves. So our heart, blood vessels, and sweat glands are affected when the concomitant autonomic neuropathy is involved. But that's what a neuropathic doctor is for, right? To distinguish between all of these things. And as you know, I have neurocardiogenic syncope, not to really be confused with vasovagal syncope, although they're often interchanged. There is a slight difference. I might do a video on that in the future, but as an outpatient test, the skin punch biopsy offers a relatively painless way to assess nerve density. The procedure allows for the evaluation of intraepidermal nerve fiber density, a key indicator of small fiber neuropathy, and can be repeated to monitor disease progression and treatment response. The skin sample is sent to a pathology lab for analysis, where it's examined under a microscope to identify the types of cells that are present and any abnormalities that are there. The pathology report will describe the cells found in the sample, indicating whether they're normal or abnormal. Abnormal results could indicate an infection, a skin condition, a benign tumor, or cancer. The area where the biopsy was taken may be stitched up to close the wound. Then a bandage is usually applied, and aftercare instructions will be given. So, is this something you're interested in? Find a neurological center or neurology department and call them to find out if they even do a punch biopsy. In the US, it seems difficult to find a place to go unless you live in a giant city. But I'm in the suburbs. I live out in the country. It's a bit harder for me, but I'm not giving up, so don't you give up either. Always confirm with your doctor to rule out other causes like diabetes first, sure. Then consistently pursue your desire to be tested. So I hope you learned something, and I hope this all made sense. I send you gentle hugs and support. Love you. Yep, nails are all gone, except for the thumbnail. Yeah, it's still on there. I just cut it down real short. Ugh.